Worry, stress, and mental illness have become the defining health issue of our time. If you are struggling or you know someone who is, it can be very difficult to find a place to start. This short, simple video is designed to help you or help you help someone who is struggling in 3 simple but not easy steps. The first step is to realize the magnitude of the mental health problem today. And if you are struggling, you will clearly see that you are not alone. In 2014, the American Psychological Association and the American Institute of Stress released research reporting that 73% of us feel the psychological effects of stress. 77% of us feel the physical symptoms of stress. The National Alliance on Mental Illness reports that 6.7% of the population suffers from major depression. 18.1% suffer with an anxiety disorder, including PTSD. Bipolar affects 2.6%, and fully 20% of youths aged 13 to 18 experience a severe mental disorder in any given year. It really is too much to comprehend. So let's keep it simple, round down, and say 25% of the population is struggling with some type of emotional or mental illness. Think about the uncomfortable math. 25% of the population is struggling with some form of emotional or mental distress. That is powerful information for anybody who is feeling vulnerable. And now consider this. If only one other person in their life is affected, like say a spouse, child, or sibling, then around 50% of the 7 billion people on the planet today are directly affected by this. That's around 3.5 billion people. If you are not personally affected, about half of everyone you know is personally struggling or caring for someone who is. So here is how you can help. The second step is to learn how to recognize the signs of someone who is struggling. If you can do this, you could literally change or maybe even save the life of someone you care about. The American Psychological Association says that one of the most common signs of an emotional crisis are changes in behavior. So look for the signs of neglect of personal hygiene, dramatic changes in sleep habits such as sleeping more often or not well at all, weight gain or weight loss. Look for declines in performance at work, at school. Look for pronounced changes in mood such as irritability, anger, anxiety, sadness. Look for withdrawal from routine activities and relationships. The American Psychiatric Association also suggests looking for warning signs that include problems with concentration, memory, or logical thought. Also look out for a loss of desire, social withdrawal, and in children, pay special attention to signs of weight loss, weight gain, or self-harm. So now we have established that around 25% of your friends, family, and colleagues are struggling. Now you're able to hopefully realize this is a big problem and now recognize who is struggling, and then you need to reach out. The most important thing you can do to help a friend or loved one is encourage them to seek professional help. There is no substitute for this first step. You can also ask questions like, I've been worried about you as it seems you're going through a difficult time. How can I help you find help? Reassure your friend or family member that you care about him or her. Offer to help your friend or family member with everyday tasks. Try and educate yourself on mental health. Try and stay in contact with them on a regular basis, even if they don't appear to be receptive. And encourage them to visit conquerworry.org and watch this video. This 3 R's of mental health awareness campaign is designed to help you help someone, or to promote better mental health in your business, school, or community. Please feel free to use this video and accompanying materials to promote better mental health awareness in your organization.